Welcome everyone. It is past 9:30 in the morning on Saturday. Thank you for joining us on 23rd of January 2021. My name is Ranjit Kaur. I am a breast cancer survivor for 22 years and I'm also the president of Breast Cancer Welfare Association Malaysia. So we have a talk this morning and we have a very interesting topic which is on bladder control and sexual health after breast cancer. The speaker is Miss Nurfatini Zolkepeli, and she is a physiotherapist who is specialized in women's health, and she's attached to the Vibrance Pelvic Care Center in Kuala Lumpur. Miss Fatini, thank you very much for agreeing to speak. Miss Fatini will speak for about 40 minutes, and after that, we will have a Q&A session. And during the Q&A session, you can actually, during her session when she's speaking, you can key in your questions in the chat box so that we can save time and she can spend more time answering your questions. So over to you, Ms. Fatini. You want to share your slides now?
Hi, thank you, Mrs. Ranjit. So I will now share my screen. Hi everyone, thank you for joining me today this morning. So my name is Tini and I am a practicing physiotherapist in women's health area. So my topic today is about bladder control and sexual health after breast cancer. And before I start, just want to repeat again what Mrs. Ranjit says, that there will be Q&A session at the end of my talk. So as we go on, if you come up with any questions, feel free to put it into the chat box or write it down so that you don't forget. And we will revisit them when we wrap up later, okay? So I understand that some of you, or if not most of you, have dealt with and have won the battle against breast cancer. And you must have gone through your fair share of treatments to get better. And for that, you deserve a clap for yourself for rising to those challenges, fighting the treatment battles, and making a positive, healthy changes to your life and lifestyle, which bring us to our talk today. So surviving rounds and rounds of treatments such as breast cancer treatments, even though you may have put the words behind you by now, like those immediate side effects from the therapy, such as the temporary hair loss, the nausea, fatigue, and pain, there are some less immediate side effects that may have stayed on with you since then. So before we go into that, as a practicing women's health physiotherapist specializing in women's pelvic health issues, so on a day-to-day basis, I actually help women to regain bladder control, restore the sexual sensations and functions, and treat and strengthen the core and the lower back, and also treat other pelvic health related issues. So some of you may have heard about the organs falling out of the vagina, especially the womb, or in Malay we call it as the jatuh rahim. Yes, treating that is also what I do. So by now, you may wonder, what does breast cancer have to do with bladder control and sex and me doing here today? So the answer actually lies in the treatments of breast cancer itself. But why is that? Because based on the findings from multiple clinical studies on breast cancer treatments, there are mainly three types of the treatments that can actually affect our ability to control our bladder and also affect our sexual functions. So you may be familiar with them already, which are the chemotherapy, radiation therapy, and also the hormonal therapy. So based on the clinical studies, chemotherapy is shown to affect our ability to control our bladder because there are peripheral nerves at your bladder and they may get damaged over the course of the treatments. And nerves are important signal carriers to the brain, and when the nerves are damaged, naturally it will be harder for us to control our bladder. Same goes with radiation therapy. But radiation therapy is more local. So if the cancer cells separate to lower areas such as the abdomen, radiation near the pelvic region can also similarly affect the delicate and sensitive bladder. So a nerve problem might affect your bladder control if the nerves that are supposed to carry message between the brain and the bladder do not work properly, which leads to the frequent urinating, intense and strong urge that you can't control, and probably once in a while gets you to leak before you even get into the toilet. So that's how one part of the side effects from cancer treatments, in which it affects your nerve and eventually make it harder for you to control your bladder. So how do we overcome these problems that is due to the nerve damage? So if you have done the therapy involving these methods before, from a medical standpoint, the significant way to overcome it is by doing the bladder training. So the purpose is to retrain your bladder to a normal process of bladder habits. And second is the lifestyle modification, such as avoid bladder irritants that can cause the uncontrollable urge, and also drink adequate water intake to keep your bladder healthy. And lastly is strengthen the muscles that control your urethra, which is the opening where you pee. So this is to prevent urine leak because strong muscles can keep close the urethra when needed. So we will go deeper into that later in my talk today. So before doctor determines whether there is a need for surgery or further medication, normally in the medical world we will suggest these conservative treatments first because they can help to reverse the symptoms. So another culprit is the tamoxifen, which is a drug widely used for prevention and treatment of breast cancer. Also comes with possible side effects of making your vagina dry, in which can lead to a problem later on in your sexual life. Other than that, tamoxifen also can lead to urine leaking problems. But how is that possible? So the way tamoxifen works is it's part of hormonal therapy where it blocks estrogen hormone on breast cancer cells so that the cancer cells won't grow. However, for us women, estrogen hormone is like our best friend. Without estrogen, it can cause a major and most of the time the undesirable changes to our body. Why? Because this hormone help keeps the urethra healthy and contribute to the strong pelvic floor muscles by improving the muscle mass and the strength. So in case you haven't really heard about pelvic floor muscles, this thin sheet of muscles inside our body in the lower abdomen area or the pelvic region is the main hero that are responsible for controlling our pee and also being responsible for the shape of the vagina. You must be wondering why pelvic floor muscles is important and how it is related to bladder control and our sex life. So to answer these lingering questions, I want you to pay full attention to the next slide of the pelvic models and diagrams because it is going to explain a lot of how certain breast cancer treatments affects how our bladder control works and how our sexual health is. So as you can see here, these organs are located inside the pelvic cavity, with bladder is at the front and the uterus is in the middle and the rectum is at the back. But how can these organs floating around and not fall down? It is because of this group of muscles which is called as the pelvic floor muscles. So now let's see from the bottom view. So you can see the all the red color underneath the organ is actually the pelvic floor muscles who supported it so that it won't fall down. Other than that, it also covers the three openings at the urethra where we pee, at our vagina where the intercourse and vaginal births take place, and also the anus where we pass motion. So basically, your pelvic floor muscles are the one who supports and control the function of your urination, your sexual function, and also anything that relates to defecation. So you can think of or imagine pelvic floor muscles is like a rubber band. It's very similar in properties. It can be stretched, but it can also become loose, and that creates some problems. And it can be too tight as well, which also creates another problems. So example, when carrying a baby, it can stretch up to a double of its normal state. And it is also the muscles that you use when people say push during delivery. So the only difference is pelvic floor muscles thrive on estrogen. So relating back to treatment options that affect body cells and our hormones, they actually directly impact the state of our pelvic floor muscles, which again I want to remind is how we control our bladder and our sexual functions. So let me show you something. So here is the normal healthy pelvic floor muscles looks like. So the pink color that looks like a sling stretched out is pelvic floor muscles. You can see the structure of strong pelvic floor muscles that keep close the three openings, which are the urethra, vagina, and the anus. It also strongly supported these organs from falling down. And not just that, your pelvic floor muscles also one of the core muscles that provide stability to the spine. So now let's look what happens when the pelvic floor muscles is not great or get weakened by the drugs and cancer therapy. You can see the pelvic floor muscle structure is getting loose and unable to hold these organs in its place and eventually causes it to fall down, where we call it as prolapse. So when it's weakened and loosened, it also causes the urine leak or fecal leak, because you see here that it is not strong enough to keep close these openings. So this becomes more obvious when you cough, sneeze, laugh, carry heavy things, or even simple exercises. That's because the muscles are so weak they can't even take the added internal pressure. So look here, the organs also press down on the spines because the muscles are no longer strong to keep it in its place. So it increases the tension to the spine and causes your back muscles to work harder. So when it's overworked, there you have the back pain that never seems to go away, even though after getting a massage or even after doing the back exercises. Okay, so we already learned how pelvic floor muscles control our bladder, but what about sexual function? Okay, so you can see here your vagina walls are actually layered with the pelvic floor muscles. It means that these muscles are the one that give you sensation during your sexual activities. It also means that these muscles are the one helps to increase blood flow to your vagina, in which cases I believe it is very beneficial to have a good and strong pelvic floor muscles to increase the moisture and lubrication. And very importantly, when it is loose, our vaginal canal also loses its shape and firmness, and along with it, our sensations. So now that we can see how our bladder control and sexual well-beings are affected as a not so obvious side effects of breast cancer treatments, I also want to highlight that the pelvic floor muscles, like any other muscles in our body, will get weakened over time due to the aging process and also the decreasing levels of estrogen when we near or hit a menopause. So regardless of your medical background, if you are a woman, you are at high risk of getting your pelvic floor muscle weak as we get older. And then other than that, pelvic floor muscles also will lose its firmness and strength with pregnancies. So notice I say pregnancy and not particularly childbirth, because whether you have a C-section or the natural process of vaginal delivery, actually the pregnancy process is the one that wearing out the muscles. Trauma during childbirth also can increase the risk to get pelvic floor muscles weakened because of the injury to the muscles. So for example, the use of forceps or vacuum as a assisted delivery might have injured your pelvic floor muscles during the process. So that's also why most people think that leaking urine, losing sexual sensation is a normal part of aging. So now you know that it's the inner muscles that are responsible for maintaining your bladder control and sexual well-being. So you're already ahead of many people to make sure you can enjoy your normal quality of life, which can be a luxury for someone after they lose the ability to control pee and lose the sensations. So what can I do? Okay, don't worry just yet. Just because you have gone through treatments or have reached a certain age, I do know some women who say that they don't leak urine even when they are in their 50s. On the other hand, statistics and clinical studies tend to believe women often underreport bladder control and sexual health issues because they are the embarrassing issues, and some people don't even know where to seek help if they have the symptoms. So as a women's health physiotherapist, I typically recommend a woman who have done surgery around the pelvic area and post breast cancer treatment women who've aged 40 years old and above, and women who've had more than one pregnancy to do a pelvic health screening so that we can check the condition and risk of losing bladder control, risk of having prolapse, because believe me, that's not fun at all to see your bladder or uterus outside of your body, and also the sexual well-being aspects. So in regards to that, um, if you like to do the screening with me at my center at New Delhi, you can PM me at our WhatsApp care line on the screen now and mention you heard about the screening from this breast cancer talk and actually be entitled to 50% of the normal price. Because Mrs. Ranjit here has been so kind and done so much work promoting women's health. So I feel we should do our bit to encourage more women, especially women who have been through cancer, reaching a certain milestone in life, to make sure we can have a better bladder control and sexual wellness. Some of us here may already have symptoms. So what then? Actually, there is a one thing that can help you reverse or even cure bladder control and restore your sexual sensations when you do it consistently and do it right. You already know you already know that the pelvic floor muscles is the main factor in your bladder control and sexual wellness. So like any muscles, you can strengthen it by doing an exercise that some of you here may already know or have heard of, which is the Kegel exercise. So when you combine Kegel exercise with your already healthy lifestyles, such as maintaining normal body weight and doing some bladder training as a good bladder habit, avoid bladder irritants such as drinking coffee, tea, or alcohol, and also avoid lifting objects that are too heavy and drink adequate water daily can help to manage your bladder control problems. And also, when you start doing Kegels, you also will see the improved blood flow to your muscles around the vagina, also your vagina tissues, which can also increase the lubrication and moisture to soothe the vagina dryness that you might have. But in order to get its benefit, You must do your Kegel correctly. Most people get it wrong because obviously we can't see the muscle. And my boss who goes to walker classes always share with me that learning to do Kegels is a lot like learning how to sing nicely and properly, because you can't see your walker chords or touch it, but you need to control it and use it. So it's the same thing with the pelvic floor muscles. So challenge number 1 is actually to do it correctly. But how to do correct Kegel? So as you know, today's topic is not about doing Kegels, but to thank you all for staying with me until now and still haven't fallen asleep. I'm going to give you all a bonus and a free sharing about it anyway on the 3 most important tips when you do your Kegels. Now, please pay attention. This is important for you to take note. So first of all, it is the self-correct method, which is the easiest because you can do it on your own. What you can do is using your hand to guide you whether you are using other muscles or not. So you may put your hand on the tummy to ensure there is no contraction of your tummy during Kegel. And also remember to breathe normally. So what you can do is you breathe in first through your nose, and as you breathe out, squeeze your pelvic floor muscles by imagining like you are trying to stop your pee halfway. And if you are like twitching your face or clenching your face, you are already doing the wrong. Your whole body needs to relax. And if you stop breathing in or out, you are also not doing it as it should be. Okay, so another thing that you can do if you're still not sure whether your pelvic floor muscles are contracting or not, you can try place your fingers at your perineum. So where is the perineum? The perineum is located between your vagina and anus. So what you should feel during correct contraction is the perineum moving upwards and inwards. That's the correct contraction. Okay. So let's moving on to the second tips. So number 2 tips is you can use a device to help you do the self-correct. So if you had tried to do self-correct but still unsure, that's fine because there are certain medical devices to help train your pelvic floor muscles in the market if you are open to the idea of it. So I'm going to show you a few of the examples of the device that are in the market. So here is the most common one. I think most of the hospitals use this, which is the perineometer. So it uses the air pressure to detect whether there is a contraction of pelvic floor muscles. And this is the Kegel master. It uses a hard spring to let you feel it and try to contract it by giving some resistance. And this is the perifit. It connects to your phone and give you some feedback. So personally, from a medical safety point of view, what I look for in a guidance device is combining all of the above. It should be made from the medical grade materials so it doesn't harm our delicate parts. It must give me and the user the accurate biofeedback. So what does it mean biofeedback is it means that it lets you know that you are exercising the correct muscles, which is we cannot see. Otherwise, why I use the device, right? So, even for singing or music instrument tuning, people also use a device so that they know they are using their muscles to sing the correct tune or correct note. Same for Kegel, the device need to send us a signal to let us know we are actually using the right muscles. And it must be based on clinical standards, which is the same standard as what we medical professionals use to treat and engage the pelvic floor muscles. And lastly, Of course, it must have a resistance because muscles need to progressively strengthen. If not, it will stay in the same level and never improve. So it's like we lifting air with our biceps. Repeat 1,000 times. Know where our bicep is going to be strong and toned without the weight training. So I'm going to show it to you what I usually use in my practice just to share with you. So this is what I use in my practice, which is this device. So usually I use the device also to test my patient's condition and also in the training of Kegel and also use it for the treatment therapy. Why I use this is because it has all of the points I mentioned above. It doesn't give the false positive or false result. And besides that, it is very accessible because we can also see this device in a few hospitals here, like in the Pantai or Columbia or a few of women's health clinics here in Malaysia. So usually for the normal user, it takes just about 5 minutes exercise a day with this device, which is already very good for improving the bladder control and vaginal firmness. So all of this device is good for those who don't know whether they are doing the correct muscles or not. So they just like the existed device. And if you have more questions about this thing later, you can ask me later, okay? All right. So the last tip that I can give you today for free is you all may have seen some of these or have heard some of these, which is the vagina cones or vagina weights. My advice is please don't use these vagina weights or cones or balls to train your Kegels. Because if you have followed my talk so far, what we want to do is tighten it back and make it stronger. So the correct thing to think about when you train your pelvic floor muscles is to go up. The weights and the balls tend to drag your pelvic floor muscles downward. And if you are already weak and have symptoms, these products may do you more harm than good. So please consult specialists before you use these products. So with all the tips that I gave to you, with that I'm nearing the end of my talk, and as a few final words, I hope that you have learned a lot today regarding some questions that you may have had about bladder control and sex after breast cancer treatment, or in general just learn more stuff about women's health and possibly one of the most neglected areas of our body, which is our pelvic health. So I hope you can follow my advice on doing the Kegels even starting from today, because by doing it for just 1 to 5 minutes a day and like 2 to 3 times a day when you wake up, before you sleep, or just when you are cooking or driving, you can actually restore or prevent so many things that related to your pelvic that we may take for granted each day. However, you must ensure that you are doing the correct Kegel for it to be effective. And if you already have some symptoms, I strongly advise you uh, to see a gynecologist, or you can come see women's health physiotherapist like myself early, because this kind of health issues they begin looking like something, but as we continue to neglect the signs, they will get worse and worse, and it can be permanent or irreversible at some point. Okay, so to end my talk on a happy note, I'm going to share with you a real life success story about one of my patients that having bladder control issues, and she completely overcame it. So let's call her Mrs. Y. She's actually 31 years old with married already with one child, and she actually complained of urine leaking after the intercourse and occasionally leaking during coughing or laughing. So, like many, she went to see her gynecologist and was referred to us. And then after 3 sessions of guidance and personal therapy, and also she doing the homework that I gave, the result after 3 weeks is that no more urine leaking after the intercourse or coughing, and she even said that she felt more confidence. So when you do something about it early, you can actually prevent it from getting worsened or even can cure it. So after seeing in so many cases, I strongly recommend not to wait until things become so huge impact on your quality of life, especially if you can identify with some of the symptoms already. So now it's your time to take an action today and change your life. So lastly, I'm going to leave this slide on for about 30 seconds like that for you to take a screenshot or copy down the information if you wish to talk to us about anything, especially in private if you're shy to ask here. Yeah, we cover a range from bladder control, sexual wellness to pain and relationships because we also have our own in-house sexologist in our center. So if you are curious about what she does and also what I can do for you, just feel free to get in touch with us. Okay. So I guess with that, thank you for actually listening to my talk, and I hope you gain something from this talk and able to take an action today, be it as small as start doing Kegels using the self-correct method that I taught you just now. So take care and stay safe, stay healthy, everybody. Thank you.
Thank you, Ms. Tini.
Yeah, I think we can
Um,
move to Q&A.
we will go to Q&A now.
Yeah, I will.
For that, I was wondering if it is possible for you to do
Mm-hmm.
a session right now for a few minutes. Everybody
Mm-hmm.
is mostly sitting down at the moment on a chair. If
Mm-hmm.
you just guide the group, many of them are also from out of town. They are not in KL or Selangor.
Okay.
In the meantime, if you could guide them step by step, like as though you are teaching them, and see whether they can do the exercise, the Kegels exercise or not. Is it possible for you to do a demo right now so that they get an idea as to how they should be doing it? You mentioned just now in your slides, but I think a practical session would be quite useful for them. So over to you, if you can just do sort of like a instruction to them, what to do first and what to do next, and what they can feel while they are doing it. I mean, being a physiotherapist myself, I know that Kegels exercise for us, we were teaching patients when we were students ourselves.
Mm-hmm.
So yeah, so could you do that?
Yeah, sure. I can show how the step by step and what to do before, after, during. So maybe I will stop sharing the screen. Is it okay?
Yes, that's
Mm-hmm.
okay. And also, as we have said, it's Q&A session. Please key in your questions in the chat box so that Ms. Tini can answer them, because we're very short of time. We may not be allowing everybody to speak. Over to you, Ms. Tini.
Okay, all right. So if you still remember from the tips that I gave you just now, so one important thing to take note is that before you doing Kegels, you must empty your bladder, because when your bladder is full, it's actually put a lot of pressure to the pelvic floor muscle. So when we do Kegels, the pelvic floor muscles cannot contract in its optimized contraction. Okay. So the same things, you can use your hand actually to guide you. You can put on your abdomen. I think here. Okay, you can put in your abdomen. Okay. So you need to breathe in through your nose and breathe out through your mouth. As you breathe out, you need to slowly contract or squeeze your pelvic floor muscles, like by imagine like you are trying to stop pee halfway, or like you are trying to holding your pee. So that's the feeling or how to imagine it. Okay, so we can start. Breathe in first, and then as you breathe out, slowly contract, like imagine it. Okay, so the purpose why you put your hand on the abdomen is because when you feel like your tummy, if you feel like your tummy are the one that like contract, it means that you are not contracting the pelvic floor muscles, you are contracting your tummy. Okay, so this hand is like to guide the tummies to be relaxed and just focus on the pelvic floor muscle itself. You can also remember the picture of the pelvic floor muscle that I showed you just now. So we can try to do it one more time. The same technique. Okay, you just breathe in through your nose, and as you breathe out, slowly contract your pelvic floor muscles, and then relax. Okay, so let me assure you that for those who are doing it for the first time, it is going to be very difficult. Especially we cannot. You may feel like, oh, I don't know, is it moving or not? So to ensure that it is moving or not, I also show in my tips just now, which is you can place your fingers at the perineum. Okay, so imagine this is your vagina, and then this is the perineum. The perineum is the place between the vagina and anus. So you can put your two fingers there, and then the same technique also, just breathe in, and as you breathe out, so slowly contract it. So when you contract it, you can feel that it's moving inwards and upwards. So that's the feeling of how correct contraction. So if you put your fingers and you still can't feel it, or very just twitching only, that's fine, that's okay. It means that your muscle started to activate back. If you don't feel anything, it could be because you're not actually moving the pelvic floor muscles. You're actually moving the abs, the thigh, or even the buttock. So even for those who already come to the session a few times, it's still very hard for them to eliminate those the compensated movement from other muscles, because when the pelvic muscle is weak, we already used to using other muscles. So that's why, like I said, start gently, start with just breathing first, also okay, like breathe in and breathe out, and then after that try a few more times with contractions. So how to do contraction is you can imagine. So I'm seeing a lot of imagine, because obviously we can't see the muscle, so we need to do more on the visualization. And also the visualization also will help, because it sends signals to your brain, and over time it will be the familiarization. The brains will be familiar, and then it will send more nerves to actually activate your pelvic floor muscles. That's why the more you practice, easier you get, the easier to get the correct Kegels. Okay. So I hope that it's very short, and then it's not like very in details, but I hope it helps most all of you here to do the Kegels. But if you wanted to know more, you can approach me privately, or or can follow us on our website, on our social medias, because we also give a lot of tips on how to do Kegels, the videos and everything. Okay.
Thank you, Ms. Tini.
Yeah.
I was just wondering that people may be thinking, how do you feel the perineum with the two fingers? You can actually do Kegel's exercise in lying position with your knees bent. So you can actually feel it as well at that time. What she showed you in sitting position or standing position was because you are sitting at the moment.
Yeah.
And otherwise, generally, you can do it in lying position, which is much more easier for you to also monitor about the movements of your perineum, and as well as how you're breathing in and out, as well as contracting your abdomen as well. So thank you, Ms. Tini. And there is a question here who says that to get a discount, what does she have to do at your place? What does she have to tell your people in your center?
Oh, you can mention about I heard about the 50% discount from the breast cancer talk, and then they will guide you what to do after that through the WhatsApp. Yeah, you can do that.
Okay, thank you. I just wanted to add a few things. One was benefit and risk, because I wanted patients to know that you can't just say that you don't want to take chemo because your pelvic floor muscles will get weaker. So the benefit of the chemotherapy is very important to all of us who go through chemotherapy, because it helps to save our lives, and it also helps to reduce the risk of the cancer coming back. And the other thing is the estrogen effect issue, the natural effect that estrogen starts to get less and less as you are closer to menopause, and after that it's sort of almost depleted. But of course, estrogen is still available in some other organs that do produce estrogen besides your reproductive system. However, for those who are estrogen positive, you have to go through the hormone therapy just to save our lives. That's again a life-saving strategy. So any kind of treatment that's given to us, the benefit and the risk is weighed out. If the benefit is much higher than the risk, then the treatment is given to us because it is meant to save our lives, to give us additional years to live longer. So I think we need to take that into consideration. And Ms. Tini had also mentioned the fact that the aging process, whether you have breast cancer or not, aging and menopause are generally the factors that create this kind of situation, and it brings down your quality of life as we move on. And as we age, we may not be moving so fast, and you want to run to the toilet. There are different types of incontinence, as they say, the bladder control issue. There are different types. And I'm sure if you see Miss Tini during a consultation, she will probably also explain. And before that, she will take your history to find out at which point is it that you're having this urine leakage. Is it a constant dribbling, or is it an urge thing, or is it when you're coughing or when you're sneezing? There are different levels of it. So expertise is needed, first of all, to actually assess your condition before she actually finds out what she can do about it, or whether she's going to refer you to somebody else for further treatment as well. I mean, it could be different levels. Like she showed the rubber band, and this rubber band is taut. It is strong. It has got very good strength during younger days. But as we age, like they say, if you don't use it, you lose it. So you need to keep exercising to maintain and to strengthen as well. So are there any questions? We just have about 10 minutes to go.
Okay, got one. She says that my vaginal canal is very dry and really painful during sexual intercourse. Even if I try to use any lotions or oil, can Kegel exercises help? Okay, so I think in the talk just now I already mentioned that Kegel can help to improve the blood flow to your vaginal tissues. So yeah, of course it can help. And the lubrications like using lotions or oil also can help. So it's very good if you can do it both now. Okay? So the Kegel exercise is the main thing, because the more you move your pelvic floor muscles, it contract. When there is a contraction, there will be a movement at your blood vessels. So it's improves the blood flow, and it carries the everything, the nutrient, the oxygens that will soothe the vagina dryness. Okay. So the next question is, someone asked, what is a bladder irritant? So bladder irritants it can be food or drinks that we take. So that's why it's more towards lifestyle modifications. And some of it is the more, I think the main one is the coffee, tea, alcohol, and then even the citrus. So these are bladder irritants. You doesn't necessarily like avoid it at all. You can take it, but in a way that is acceptable to your body and to your bladder. So this for this design program for you, which is like a bladder diary, or which bladder irritants to avoid is is more preferably you consult with the pelvic health expert or the pelvic floor physiotherapist. Okay. All right. So the next questions. Can I know what was the last device that you showed that is most useful and has all the criteria you mentioned just now? And please give the phone number for the pelvic test. Okay, so for this, the device, the name is actually Vibrance Pelvic Trainer, and you can find out about it more on our website. Our website is at vibrance.com.my. And also in our website also have the phone number that you can contact us as well. Okay. Right.
Why coffee and tea is irritant?
Okay, so to answer this, it's because of the ingredient in the coffee and tea itself, which is I'm not the most experts on this, but this is the one that it causes your bladder to fill up early, and then you feel the urge too many times that you can't control. So that's how it relates. Yeah.
Okay, next
So,
question. After intercourse, I will have urine tract infection. What to do?
after intercourse. So for the urinary tract infections, what to do is first you need to go to the clinics and see the doctors, because for the infection to go away, you need to take the medication or whatever doctor prescribe. And yeah, so actually it's not related directly to pelvic floor muscles. However, it related to the medicals kind of things. However, after getting the urinary tract infection, it might cause some tension or tense pelvic floor muscles that could be problems later on, which is can also be resolved like what I've told many times with the Kegels. Okay.
Okay, next, how do you overcome vaginal dryness and painful intercourses?
Okay, so what for the vaginal dryness, like I said, you may want to consult with your doctor as well to see if doctors have more broad what we say special treatments for you. But from my point of views, what I can suggest is first, of course, doing the Kegels, and you can use the moisture or any lubricants together, and also for the painful intercourses. First of all, you need to know that our vagina, it will secrete their own lubrication when we have arousals. So maybe you can add it with the foreplay, and also doing the relaxation. So the relaxation is like you need to uh, not focus on doing the contractions, but focus on relaxing your pelvic floor muscles. So how to do the relaxation is when you contract, when you do Kegels, you contract and then you release. So the release part is need to be more longer than the contract. So the tricky part of relaxation is that for those who first time or didn't even know how it is very advisable to seek the pelvic health expert, the pelvic floor physiotherapist, to actually, because the pelvic floor physiotherapy will check the severity of the pelvic floor muscles tightness or the tension, so that she can give quite appropriate treatments for you. Yeah.
The
Miss
next
Tini,
question. Okay.
just a moment, Miss Tini, regarding the lubricant, some people just go for just any cream. I think maybe some examples would be important. Secondly, if people are estrogen receptor positive in their breast cancer, they have to make sure that they don't take any lubricant that has estrogen in it. So are there any examples of lubricants in Malaysia that people can just buy off the counter?
Okay, so usually what I use in my practice is the most, I think even in the pharmacies, in the Watson also got the KY jelly, because it's a water based. So it will not interrupt with vagina pH. So yeah, but I'm not sure whether it has the estrogen or not on regarding that. So I'm really sorry for my part. So what I do know is that KY jelly is the most friendly, and then the most what we say no harm side effects, that I also use with my patients, and also advise my patients to use it when they are trying to do to reduce the painful the cost.
KY jelly has no estrogen in it.
Yeah. So yeah, you can buy it. I think dekat at Watson, Guardian, also other pharmacies also sell it. Yeah.
I seen urology and on medication, and after few sessions, I stopped as seems no improvement. Can I come over to do pelvic screening or continue with urology?
Okay. So for this part, I will suggest, yeah, you can come for the pelvic health screening, because most of the doctors, they don't do specific for the pelvic floor, because it's related to the muscles itself, and usually physiotherapists, they are the one that actually check the muscle strength, the muscles condition. So yeah, I do advise you check for the pelvic floor. And then if after doing the pelvic floor muscle training and everything is still not go on, then I will suggest you to consult back with the doctors about what the possibles. Usually the combination between doctor's treatment and the pelvic floor physiotherapist is actually will give more better results. Yeah.
Miss Tini, I just wanted to add that many of us women, I mean, I've noticed that women who, have back pain, back problems, or even pelvic floor problems, they may not recognize that it's a pelvic floor problem, and they go and see a doctor, and no, I think about 99% doctors will not do a check to find out whether the pelvic floor muscles are strong or weak. So that's the other issue, that there is generally not done in a setting where patients go and see doctors when they have problems. And the other thing, of course, is the issue of between pelvic floor issue and lumbar back pain, or lumbosacral area, which is the lower back. For those of you who know, it is the curve that you have at the back, at the lower back. That part sometimes becomes very stiff, and you have pain from there, which then also extends over to the pelvic floor as well, and makes the pelvic floor weaker. So you have like complex issues. The doctors end up giving you painkillers from time to time, and you still face the problem because the muscles are not doing well, and your body is becoming stiffer and stiffer as you age. So the thing is, it is important to see someone like Miss Tini, because she can actually assess you not just from pelvic floor point of view, but also from the lumbar and the lumbosacral point of view, to see what actually the problem is. So in Malaysia, we don't really have medical doctors, really checking to see whether you've got a problem with your pelvic floor or not.
There's one question here: how to order the device that you use? Can we actually buy off shelf? Is it advisable to buy?
Yeah, actually the device is, like I said, is a assisted device, so it can help to give you signals that you are doing the correct muscles by giving the feedback such as vibrations, and then when you feel the vibration means that you are doing the correct muscles. So yeah, for those people who don't know where the closest pelvic floor physio that's offer to do the treatment therapy, so you can buy it. Actually, it's on it's on our website. Can even from the overseas also we ship up. So you can visit our website at vibrance.com.my if you want to know more about the device. We have the video and everything on how to use it. Yeah.
I want to add one question to that.
Yeah.
Should that device be bought after consulting you instead of just buying it after looking at the website? Thank you.
Okay, so usually when people buy this device, we will give 30 minutes free session with physio with me, so we can like share on how to do it, and then do it how to do like according to your muscles, what in positions and everything. But however, in the websites, in the videos, in the our manual instruction is also cover everything from A to Z. Like if you are in Malaysia and if you are around in the KL area, yeah, you can just let us know, and we will give you the sessions to consult with us how to use the device. Yeah. Okay.
How to overcome vagina itchiness? Is it related to you?
Vagina itchiness.
Yeah.
It's more. It's not. I'm not really expert on that, but what can I advise is, you need to prevent your panties. Yeah, wet. Make sure it's dry. Even after you went to the toilets, you need to wipe it before you wear your panties, because the moisture and everything can cause the itchiness. So yeah, that's from my part. I'm not really an expert on that.
I can add to that. Your panty has to be cotton. It should not be synthetic material. Try not to wear underwears and pants that are very tight. That can also cause irritant. It could be having some kind of allergy as well. It could be a fungal infection. It could be anything actually. You need to see a doctor if it continues.
Is screening center opens during weekend?
Currently, yes, we do have, but because we are currently moving from our old center at Bangsa to the Mid Valley, and then also because of the MCO, we still haven't released our official hours yet. But usually, yeah, we do open on weekend as well. So you can check it out on our social medias like Facebook and on IG. Usually, we will post our latest announcements.
There's one question here saying that KY jelly dries off very fast and is sticky. It is water-based, right? And I want to add to that question, how many times do you have to apply the jelly whenever you have intercourse? Is it just once or what? Thank you.
Okay, so usually why water-based lubricant is better is because it doesn't interrupt your vagina pH. So that's why we actually advise on using the water-based. However, if you find it the KY jelly dries off very fast and is sticky, you may want to put it a few times the KY jelly so that it doesn't dry off too fast. And also, like I said, for the intercourse, the arousal part, the foreplay plays an important role as well to make sure your vagina keeps on getting moist. So that's one part to look at. Yeah. So usually in the sexual part, we have our own sexologist, and she also can help advise on how to actually get more more arousal, more moisture, other than using the tools. And then also, of course, the exercise part is also one thing to take note on. Yeah.
How many times do you need to do Kegel a day, and what's the best time to do it?
Do it at any time. Standing, sitting, cooking,
Yeah,
any time.
true.
Lying down when you wake up in the morning before you go to sleep at night, just do it in lying position, in sitting position, in standing position. You're waiting in your car for somebody, keep doing it. Nobody
Yes,
can see you doing Kegel's exercise. Nobody can see you. She showed you just now by putting hand on your abdomen. You don't have to put your hand on your abdomen once you know how to do it. So yes, you can do it anytime, any number of times. This is a set of muscles that will just be very good to maintain strength and also resilience and resistance. And so it is, the more you do, the more you gain.
Mm-hmm. Yeah, true indeed. Yes, you can do at anytime that you feel comfortable doing it. Everywhere you want to do, even at the office or your home, you can do it anytime. Yeah, but must ensure that you are doing the correct one.
Just now you mentioned the bladder need to be emptied first, yeah, before
Yes,
you.
yes, true.
I think first time doing it, I think if you have done it many times, then it shouldn't be any problem, right?
Yes, true. So the first time, it will be really advisable to empty your bladder first, because if you have a full bladder, you can't be relaxed because feel like want to go to toilets and everything. So yeah, so make sure you empty your bladder first before doing the Kegels. Yeah.
What are the reasons that affect our bladder uncontrollable?
Mm, Yeah, from the top just now, I already mentioned about the bladder irritants, which is some of the example, which is the coffee, tea, and alcohol. So these are the only examples. There are many things. I think you can find out more if you research about it. Which is yeah, usually all those things are usually the physiotherapist we tailor to your own choice. For example, if you are a coffee person and then you doesn't mean that you cannot take it at all. That's why I'm saying seek the pelvic floor physiotherapy so that she can tailor the treatment suit to your needs and also doesn't affect your bladder. Yeah.
Why elderly women or women who are in their late 40s onwards tend to have UTI? Is it also related to the weakness in the muscle?
Okay. Thank you for the questions. Actually, like I said just now, for the UTI, is mainly because of the infection with the bacteria. So it doesn't actually relate directly because of the weakness of the pelvic floor muscles. However, like I said, after getting UTI, it may have disrupt the normal function of pelvic floor muscles, which also can be weakened. And then if you have a repeated UTI, it can cause all the weakness in the pelvic floor muscles. So it doesn't cause any harm to do Kegel even if you have a UTI. But also you need to seek a doctor, seek a consult with your doctor to resolve the infection first. Yeah.
I would like to add to this that urinary and bowel hygiene is very important to reduce the risk of urinary tract infection or UTI. One is how you clean yourself after you pass urine and how you clean yourself after you pass motion. If you're using toilet paper or anything, you cannot do it in the opposite direction. It has to go from front to back. Otherwise, if you're doing it from back to front, or if you're using tissue paper to wipe your bowel area as well as your urinary area, you might be transferring infection from your bowel area to urinary area. So it's very important to learn the right way of bowel and urinary hygiene as well. Next question.
Okay, I heard an advice saying you can also practice Kegel on a rolled up towel or bolster. Is that recommended?
Actually, the most suitable position to do Kegels is actually lying down with your knees bent because your spine, your back muscles is in the neutral position. So it's easier for you to control other muscles from actually contract and then just focus on Kegels. So other things like using towel or bolster is like and the plus tools to help like to progress the levels of Kegel exercise. But as for the beginners, I would suggest to do on the just lying position and then with knees bend. So before you sleep or before you go out from the bed, you can do that in the position. But like Mrs. Ranjit said, any position, standing, sitting also can do it. But it is not very it's just not the ideal position. Yeah.
It's a little bit like there are two things that you should do in lying position. One is the Kegel's exercise, which is very effective, and the second effective activity is breast self-examination. These two should be done in lying position when you are doing it. So these are the two activities that you need to do. Of course, breast self-examination is once a month, but Kegel's exercise should be every day, before bed, after bed, after getting out of bed. Of course, as she said in the beginning, you need to empty your bladder so that it does not come in the way of the exercise.
Last question in the chat. Besides screening, what are the other charges if need your guide on exercise?
Besides screening, what are the charges? Okay, so of course for the treatment lah, the charges is the treatment package and everything. But the treatment is actually according to your condition. So that's why we suggest to come for the screening first, and then we will advise on the treatment which is good, which package or which treatment is good for you based on your condition and personalized to you. Okay.
I would like to take this opportunity to thank Ms. Fatini for giving this very useful talk. I think most of the women would have benefited from it, also because of the fact that all being women, and at certain age groups, women tend to face such situations, and it is a topic that many women find embarrassing to go and see a doctor, or embarrassing to go and seek a consultation. I think, Fatini, you have opened up this whole avenue for people to seek support and seek advice as to what to do, and also to treat their condition, which they may be suffering silently with. And with that, I would like to get everyone to put your pictures up. You can turn on your videos so that we can take a group photograph of everyone to thank Miss Tini as well for her talk. So let's put our hands together to clap for Miss Tini, even though if it is silently.
Thank you, everyone, for actually staying to my talk. Thank you.
Thank you, Miss Tini.
It's nice to meet
Really
you
enjoyed
all.
Thank you.
Thank you. Thank you so much.
Thank you.